Mike Winters.
And good morning. It is 22 minutes after 9 o'clock. And joining us in studio this morning, Mayor for the city of Roswell, Mayor Dennis Kintigh with us. Good morning, sir.
Good morning. And I'm staring at your happy face here.
Yeah. I'm sorry if it's frightening.
It
It's very
is.
large.
Matter of fact, it's very frightening. But hey, you got to remember what I used to do for a living. Be tough. Oh, look at this. It's really, this is classy. They got the microphone all set up and everything.
Well, hopefully they, because I think they want to take it out to the Legacy Run tomorrow. As long as they keep it away from children. I think children might be scared of it.
Yeah,
but,
I think that's a good point.
Well, how are you today?
I'm actually pretty good. Obviously, much better than you. Sorry about you coming down with some crud.
Well,
but
thank you. Yeah.
Thanks for having me on.
Well, it is what it is. Just a cold. We're dealing with it. But thanks for coming on. Thanks for chatting. And I know this isn't the most ideal, but it's better than nothing.
Yeah, and it's kind of weird with me with headphones on too. It's like this looks kind of like something out of a creepy kids movie or whatever with the earmuffs.
Now you're gonna have headphone head for the rest of the.
Well, yeah,
like
but I barely have hair, so it's not a big deal.
Me either, but it finds the ones and sticks them up.
This is true.
Well,
so
let's where do you want to start?
Well, let's start with Thursday morning. I got a text message from a healthcare professional, and my phone and my life has been blowing up ever since. Turns out Wednesday afternoon, the governor issued an additional public health order. We know about much of this. It has to do with masks and et cetera, et cetera.
Sure.
But one of the really critical parts of this whole order is that if you are in a medical field, if you like working on a doctor's office or a hospital or stuff like that, you have to be vaccinated by August 27th or terminated.
Yeah.
So this is blowing up down here. Now, it's really an interesting dynamic. A day hasn't gone by that I haven't talked to a healthcare professional on this matter. And I mean, literally, yesterday included. So here's the challenge we're facing. And I have to tread carefully here because some of these folks are sharing with me, and they don't need to be out in the public getting their names out in the public. But these are all professionals in the healthcare industry. And the problem is there's a significant number of individuals who have not been vaccinated at either of our two hospitals. Mm-hmm. What those actual numbers are vary from day to day, but the potential exists to severely impact healthcare in this community. And it's not just Roswell. It's all of southeast New Mexico is having this problem.
Well, this is the part that gets me. And okay, if you have, and I'm one of these people, zero medical knowledge. I'm not, I know what is common knowledge, but I'm certainly no healthcare expert. I do know this. I know that there is a massive shortage of people in the healthcare industry, and that was
bingo
before COVID. And certainly now that we're full into this COVID deal, it's even worse. So I'm just saying, wouldn't it be common sense that the more thing we need is more healthcare workers, not less? And the last thing we want to do is terminate perfectly good healthcare workers because they refuse to comply with a mandate, even though their knowledge is the same, their skill set's the same. Everything we need from them right now is the same. And you want to help us get better, but you're going to take away able-bodied people that can help people with this because they don't want to get a vaccine. Does that make sense to anybody?
Absolutely not. And you've nailed it. A year ago, 9 months ago, 6 months ago, all these individuals were hailed as heroes, and as they rightly are. These are the people who have gone out and put themselves on the front line of care for those who are sick with COVID or other diseases or other conditions. These are the people providing care and treatment, and it's been impressive what they've done. Sometimes under very difficult situations, these individuals are willing to continue to serve this community and the other communities in southeast New Mexico. They're not quitting. They are prepared to keep at it and keep working. But this governor and her cronies, because she cannot do this by herself. She's got her little team of advisors and supporters, the people, some even in this community, who will support this endeavor that will, adversely impact healthcare. And I'm not trying to overreact here. We truly don't know the full impact, and we still don't know exactly how this is going to be implemented.
Sure.
The one thing I will encourage everybody who falls into this category, who is in the healthcare, their job is exposed here. They haven't gotten vaccinated for whatever reason. I'm an advocate for the vaccine. We've talked about this. I believe in the Trump vaccines. Mm-hmm. I've gotten them. My wife's gotten them. 2 of my 3 daughters have gotten them. Okay, so I'm an advocate and supporter of the Trump vaccine. That being said, I don't believe in forcing people. So my strong request, and that's all this is, because I don't get to tell anybody what to do. My request is that you do not quit. Make them fire you, and then put up a battle. You are needed. You healthcare worker are needed in this community. You are valued by this mayor and an incredible percentage of the people around you. Please, please do not give up on us. Please, please stay in there and fight for your jobs. Don't let them push you out. Don't let this governor destroy healthcare in southeast New Mexico.
Just curious and just spitballing, just kind of, because obviously this mandate that came down also did the same thing to our educational folks, making them get it or get tested, everything, and all this. Are there? I know the teachers have their NEA and all that, and I imagine they're probably not for this, but it's the NEA. So, is there any healthcare? I guess, for lack of a better term, just support the like your unionized type stuff for them, or are going to fight for them, or is there any of that exists?
There
or is it all on their own?
There are some unionized hospitals not down here. I think it's St. Vincent up in Santa Fe that has at least one union. There may be some service people who are unionized, but I'm not sure about that. Now, there is a hospital association. This is where it gets rather interesting and kind of addresses the full spectrum of New Mexico. There are some portions of the state where the medical personnel have almost completely gotten vaccinated, as well as the support staff. And we need both. Understand this. You can't have a successful hospital without housekeeping. And, of course, you cannot have a successful hospital with just housekeeping and no medical staff. It's a team, and all we have to be there. So that being said, there are places in New Mexico that they don't have pushback on this.
Gotcha.
And as a result, I am told that the Hospital Association, which is exactly that, an association of all the hospitals throughout New Mexico, is treading very carefully in this area. They are just not prepared to go put their neck out because they're regulated by the state. They're inspected by the state. State Department of Health controls much of what they do. So the concern is that we don't want to upset the governor and her cronies any more than they already have.
I can't imagine
mind-boggling.
I can't imagine her having any kind, because I know what's going to happen is the hospital's going to like, no, I need these people. We're going to keep them, and she's going to do some kind of sanction on the hospitals that don't fire people that aren't vaccinated. I can't imagine if that goes to court, that's going to win. I mean, it's a weird world. So the governor's been winning a lot of these, but
Yep.
at what point are you like, I mean, this is just blatant constitutional violations here. This isn't even like skirting the line. This is straight up just jumping over it.
Well, you're right. This is, and I would argue this is a failure of the judiciary in the state of New Mexico, which is, don't get me started on that one. We can do another 6 shows just on that. And the failure of judiciary and the Democrat-dominated legislature, and I'm picking on the party here. There are that maybe that's not fair. Maybe it's better we say the progressive or the ultra progressives that dominate the legislature. Because when I was up there, it was the Democrat Party was more of a spectrum. In other words, you had some more traditional, what would call conservative Democrats, and then you still had your hardcore progressive ultra liberals. And
Sure.
the ultra liberals have really taken over that whole party, and they have a commanding domination in the whole state. Now, what I've been working on is trying to get some attention through some contacts I have up in Santa Fe and Albuquerque to the governor's office to explain that this is a serious problem, that we are looking at actually impacting the ability to provide health care. Let me read, if I may, just one little bit of a letter that was written by a doctor here,
Okay.
an MD, working at one of our hospitals. And he's writing to the staff, and I'll leave the doctor's name out of it at this time, but it says, your employees were hailed as heroes for most of last year for showing up to work and taking care of patients during this pandemic. Now the governor is trying to vilify these same people as they make a personal decision to not take a vaccine which has been around for less than a year and for which there is no long-term safety data. An argument could be made to make the vaccine mandatory if it was extremely effective at preventing transmission to patients. However, this is no longer even true with the current Delta variant. The hospitals in this state are already struggling to have enough staff to cover all the physical hospital beds that we have, and there will be nurses who choose not to be vaccinated and will no longer be allowed to come to work. These same nurses, whom the governor is forcing to quit, would be happy to show up and care for patients, which is what these professionals enjoy doing and are well trained to do. I wanted to quote the doc because he says it so much better than I could. It is, Mike. This is mind-boggling. I almost feel like we're in the twilight zone, because if we're having a surge with COVID patients, why are we trying to decimate the healthcare professionals who would deal with it?
You know, that I could see this turning, if this keeps going down this path, it's going to turn into like you're going to have underground doctor clinics and things. You know what I mean? It's going to turn into like black market healthcare because they can't work technically, but they have the knowledge and know-how, and these people are like, well, I can help. I'm going to help, you know, and this is stupid. And it's like,
Yes.
all of this because we want to help. I mean, it's, to me, I look at this and like, this is where the common sense has gone out the window. It's
Exactly.
like, look, we've got a problem here. We need these people. You're going to not let them help people because for whatever reason they choose not to have a vaccine. I mean, come on.
And these are individuals who are on the front lines, and they literally can make the choice themselves. And for whatever reason, once again, I'm repeating myself, but I think it's well worth it. I am an advocate for the vaccine. I believe in it, and in fact, this physician who wrote this is vaccinated. Mm-hmm. I discussed it with another physician over the weekend who has not been vaccinated for whatever reason. He's chosen not to do it and is facing the potential of being terminated. It is just crazy what this governor and her cronies, and I keep saying that because she cannot function by herself. She has to have enablers, and her enablers are in the legislature, in the judiciary, and within her political party. They help her by basically protecting her from the adverse consequences of her bad choices.
Well, hopefully, I know this is. I feel like I'm yelling into the wind, but you hope at some point there's going to be enough people that are just like fed up and decide to stand up and fight for this, and I hope this is the catalyst that changes that and says, you know what, look, we'll wear the mask, we're doing the things, but to fire qualified people that we really need right now
Yes.
in a frontline situation. That's like saying our soldiers didn't get the vaccine, so we're going to pull them out of the front line despite the enemy,
Yeah.
knocking at the walls here. But because they're not vaccinated, we're going to put them inside, and we're just going to. It just doesn't make sense.
Doesn't.
This is really common sense 101 here, and it goes against it.
Now, tomorrow, I know you're going to have State Representative Greg Nybert come by and talk about it. We're doing a rally tomorrow at 10 o'clock. It's a press conference rally on the courthouse steps. Local legislators, local elected officials. We'd love to have any healthcare professionals who feel strongly about this to show up and just be there. They don't necessarily need to speak, but go ahead and show up in your white coats if you got them. But the point being that you shouldn't have to beg to keep your job in healthcare here in Southeast New Mexico. You're desperately needed, and it's just mind-boggling at what the governor is doing.
Yeah, absolutely. It's past the shake your head, I can't believe this. This is like, now you're doing something. You're like, all right, people. I mean, everything she's done's had this, but this is just grossly bad.
And it's interesting. We were out over the weekend doing some shopping, and the mask mandate kicked in Friday, and I'm just not seeing the overwhelming embracing of the renewed mask mandate. And some people are wearing masks, and my attitude is that's fine. If that makes you feel comfortable, go right ahead. But there are people in stores, lots of them, that do not wear masks and have chosen not to. And the good news is I've not heard of any incidents. And so one of the other things I'm going to beg people to do is let's respect each other here. This is Roswell. We're from all over the universe. Nah, just kidding. But let's respect each other. If you feel you don't have to wear a mask and don't need to wear a mask, that's okay. But don't chew on somebody who has one. Don't get in their face. Don't give them a hard time. Just respect them and keep the distance. Conversely, if you feel like you need to wear a mask and you see somebody who doesn't have one, keep your distance. If it makes you really uncomfortable, you can leave the premises.
We don't really know everyone's situation.
No.
And so for you to see someone wearing or not wearing, and you have your thoughts and things, but you don't know that they might have a situation going on or not going on, and they're doing what's best for their family as you are for yours. And if we can all respect that, may agree, disagree, that's fine. But we can. This is how we survive. This is how we did these things for a long time now. Yeah, but you move on and go about your day, and this is no different. This is no different. You got to do what you got to do to protect yourself. Some people are. This is deadly. Some, it's a cold.
Yes.
It's just, it is what it is, and people need to act accordingly.
Well, one of the interesting dynamics too is, it's obvious that COVID is never going to go away. COVID is going to be with us forever. It's just like the flu virus. The flu virus mutates from year to year, multifaceted, and that is something we have learned to live with. And we're going to have to be able to function as a society with COVID. Now, let's take the city as an example. And I raised some eyebrows the other day when I made the announcement that we will, as a city, We're not requiring our city employees to be vaccinated. That's their choice. We are not mandating that they wear masks. That's their choice. We have the signs up encouraging people to wear a mask when they come into city buildings. We have those cloth disposable masks, paper disposable masks available if they want one. But we are not denying service to anyone. In other words, if you come in because you need to have a discussion about your water bill, or you need a building permit, or you need to report a vehicle burglary, you're not going to be turned away if you don't have a mask on. We need to make sure that we continue to serve this community. And here's another thing. Municipal services are different from state. We are on the front line of services. We have, the state doesn't provide a water system. The city does. The state doesn't provide a garbage collection. The city does. The state doesn't repair the streets. The state doesn't respond to the 911 call, except some places up in northern New Mexico. But where I'm going with this is these are our city employees who are in this, and they are showing up for work. They are not trying to remotely work, and they are providing the services this community needs. And hats off to these folks for doing a great job.
Absolutely. Yeah, and I agree with you. I mean, yes, as a government, so I don't care, federal, state, local, whatever, yes, encourage people to wear a mask, encourage people to get the shot, encourage people to social distance, but mandating, you can't do that. It's slippery slope. It goes against every fabric of what our Constitution's written on and what this country's established on.
Now,
and
the other interesting thing,
that thing. I'm sorry. Go.
I was going to say one of the other interesting things is the shifting in what's happening with the schools. Now, I was meeting with the superintendent Brian Luck on Friday morning. I'm not going to attempt to explain what the new standards are. That's really not my role, but there's been a shift in how that's handled. Some of the schools are opening up again, and there's going to be different standards for for closing them. But in many ways, this strikes me as similar to when she shut down grocery stores. If you remember that, there was these groceries. This was last winter. And we had people standing outside in the cold waiting to go into like Farmers and Walmart. Sam's was closed. Albertsons was closed. And this was a real problem because you could only have 75 people in supposedly for their health. But, you could stand out in the cold and that was okay.
Right.
And this is an example of the same bad thinking and bad policy that this governor and her cronies, and I keep saying it that way, and I will continue, can have imposed on us.
Well, it's almost like the with COVID, the ideology is always to go nuclear first. Like they're like, you know what I mean?
Yeah. No, you're right. It's like, oh my gosh.
And it's like, why? We don't have to, and like you said, they went nuclear with the grocery stores. They're going nuclear here, and then they have to back it off because they're like, oh, this doesn't work. And
yeah,
just some planning. Come on, think.
Yeah, anyway. Exactly. And it's you're right. It's mind-boggling what they've done and how they've implemented these draconian measures that they ultimately have to back off. You would like to see them think a little more rationally up in Santa Fe. And candidly, I'd like to see the judiciary step up. And I keep coming back to this one, too. But we have the statewide judiciary has just abdicated its role of protecting the rights of the citizens. They refuse to do their job, and they have kowtowed to this absolute dictator.
Right. Well, and this is New Mexico. The problem that's been New Mexico is a problem for a long time is we're a state that our checks and balances have been so out of skewed for so long that now that we're in a real pickle, the checks and balances aren't there to work.
No. And it's I don't know. So I
Yeah.
feel like I'm starting to repeat myself here, which you're
I know,
supposed to do
understand.
over
I
and
feel
over
like I
again.
do that all the time.
Yeah, but very distressing, very distressing. So once again,
Absolutely.
so the listening folks can understand. Encourage, support, say a kind word to your healthcare providers if you run
Sure.
across them today. These are folks being squeezed. If they've gotten the vaccine, they should be okay as far as the governor goes, but they still have to deal with the workload. So
Sure.
I want to do a shout out to all of our healthcare providers, vaccinated or not. Thank you for what you do. You're an incredible service to the this community, and this mayor is very much appreciative of what you do.
Absolutely.
Those who have chosen not to take the vaccine, I encourage you to stand firm. Do not let them bully you into quitting. Make them fire you if that's what they're going to do, and then fight back in the courts as best you can.
Yep.
Hopefully, you'll get support. I know there's some talk of some litigation out there, but we don't know exactly what that looks like. So hang in there. Know that you're appreciated and you're valued. You're supported. It doesn't sound like much, and in the ultimate
Well,
scheme of things, it's really not much. But it's the best we can do at this point.
absolutely. Come out tomorrow for the press conference. Again, that's on the courthouse lawn, 10 o'clock, right?
Yes, sir.
So come out for that. Also, and I will talk, like you said, we'll talk with Greg and Candy and some of our state reps tomorrow. I believe in the 8 o'clock, but don't quote me on that.
I think that's right.
Yeah, I think you're right too. And and we'll talk more about this with them tomorrow. But if you've got unique situations with your healthcare workers, share those stories with our representatives. Because they're going to need all the ammo they can in the roundhouse to do any kind of legislation against this. So let them know, tell them your stories, give them that ammo to help them fight in Santa Fe.
Exactly, and that's you've nailed it. We've got to stand together on this. We got to stand firm on this. We've got to keep the level of healthcare up as best we can in this community and in all of southeast New Mexico. I haven't even touched on the word I'm hearing about Carlsbad and Lee County. One of the sad realities is the providers in Lee County are just a hop, skip, and a jump away from Lubbock or any other major cities there in Texas, in West Texas, and they can easily go ahead and get that job. Another thing that was pointed out to me is that the unvaccinated healthcare providers in this state, if they lose the job here, they can become traveling providers, and those folks get paid very well. I mean, it's a drag to go out and travel, but to do that, you would go elsewhere, and you would get paid for a while to be remote, and then come back.
It's good money for them.
Yeah, it is good money. The sad thing is, on the flip side, for our facilities here, the hospitals, you'd have to do the opposite. In other words, we're going to have to bring in vaccinated healthcare providers, and that costs more. Rather than employ the ones that live right here down the street, you'd have to bring in the outside ones, and that becomes a nightmare. I've been told that at least one contract provider has decided to not return to one of our two hospitals from a reliable source, and we don't know what other individuals who are traveling will do the same.
Yeah, it's scary, and this is government action.
Misgovernment,
is.
misgovernment. It's like, things like this kind of upset me because it gives politicians a bad name.
It's the common sense factor, and it just doesn't. It's hard for people, and I'm sure in some convoluted way it makes sense to somebody. I just don't know who or how. So,
Yeah, that's the trick. What were they thinking? What were they thinking when they came up with this? I mean,
exactly.
we educators, you have educators who get the vaccine or you get tested. So I think it's weekly now. You go in, you get your little swab or whatnot. You do it every week. And there's other areas where you either get vaccinated or you go ahead and get tested regularly. But the healthcare providers, arguably the most critical ones that we have in this whole system, are the ones being dealt with so severely.
Absolutely. Well, we better wrap things up. Mayor, as always, I do appreciate the visit.
Oh, absolutely, Mike.
and the
Thank you
update.
for making time.
Anytime. And I'm sure the way the world's going right now, we'll probably see a lot more of you over the coming weeks here as these things unfold.
Yeah, we'll see where we're at. We'll see where we're at in a week, because that'll be after this. After this is done, yeah, we'll be. It'll be an interesting dynamic, to say the least.
Absolutely. Yeah. Well, thank you, sir. We'll see you next time.
All right.
And stay healthy.
Yeah, you
Don't
do
work
this.
too hard.
Get back there.
I think the way the course is going, 1 week from today, I should be back in the studio.
Oh, cool. All right. All right.
So,
Well,
awesome. Well, thank you, sir.
Thank
We'll
you.
See you next time.
Bye.
All right.